All right, everyone, we'll go ahead and get started. Welcome to the Executing a Strong Data Analytics Strategy. I'm Erin Dettrey. I'm the Senior Product Manager for Analytics. And today we have a couple of things that we're going to be covering. We're going to be looking at the components of a strong data strategy. We're going to look at your options currently and the options that are coming. In just a few housekeeping things, there are ability to ask questions. If you look at the right-hand panel, there is a questions area. Feel free to type your questions in that area. We're going to try to answer some of the most common questions at the end of the webinar, and then we can also get verbal responses or hook you up with the right subject matter expert if the questions are more extensive. So today's agenda, we're going to talk about the pillars of a strong data strategy. What are the pieces of the puzzle that take things from just a bunch of raw data and Excel worksheets and data tables and turn them into analytics that can be made for strong decision making? We're going to talk about a couple of use cases involving compliance, population health, identification of revenue gaps, and audit risks. We're going to look at these based on the products that we have currently and the ability to see these data pieces within our products. We're also going to then turn to coming trends, what we see as data needs for the future. And we're going to end with a poll to understand what you feel is the most important piece of the puzzle that we do next. So we're going to look at the data strategy in 3 pillars. We're going to go through each of these and talk about the components and how to avoid getting lost. So when we look at data, when I look at the practice landscape, and we're talking about the entire practice as a whole, really step back and think about this as a huge set of orchards. I'm looking out my window, I can see the orchards of Christmas trees, pumpkins, blueberries, peaches. And in my practice, these could represent different locations and different service lines. One blueberry patch could certainly be my products. We have our plastics, or we have our cosmetics. And then we have, our typical bread and butter, medicine, or even our advanced procedures. And as the manager of this orchard, I need to be able to look at it globally from the top and understand the different pieces at a very macro or global level. But I also need to narrow down into, say, the apple orchard and be able to look at a specific tree and understand the pros, cons, and what's going on within that tree, all the way down to a specific branch, and then all the way down into a specific apple. So being able to look from the orchard's view to a specific set of trees, down to a specific branch, and into a specific apple is really the first pillar, because this allows you to take a very global look at your entire ecosystem and drill it all the way through the location to the provider down to the patient level. So minding the orchards is certainly data pillar number 1. Number 2 is that you need to attempt to leverage a complete data set. So the more vendors that you have at the table, so the more that you segment things like PM, EMR, pathology, or any of your ancillary services, the harder it is to get a very complete data vision. As we look forward in the eyes of modernizing medicine, we're really looking towards an ecosystem where we can provide a complete data experience across all the different products. So being able to tie things like things from your PM system, claims data, being able to connect things like provider-driven data, connect things like operational data, and even patient-generated data as well. This is on our long-term plan to help you with pillar number 2, which is to work as much as possible with complete data sets from across the entire organization. Pillar number 3 is delivery. Delivery is key because you need to avoid the data island. How many of you is this pretty common? If I scratch my head and I ask myself, I wonder if waiting room time impacts a patient-reported outcome. If we think about the steps that it's going to take in order to get to this data, just surface this data, I'm going to need to dig through my PM system to look for waiting room times. I'm going to need to dig through my EMR to connect those to patient-reported outcomes. And I'm probably going to need to get my IT guy and maybe even my data guy to get me to an Excel worksheet. Probably an Excel worksheet that I'm the only one that has access to, that I have to create a fancy chart or graph off of. And then I present this data and the next set of questions come up. Well, I wonder if that's impacted by day of the week or time of day or the check-in staff. This is the problem with having a very detailed delivery pathway that includes multiple different data sets going through one IT administrator, is that you end up with very much a data island where you get to one answer that only you have, only just have to go through this pathway repetitively. So to answer this next set of questions, I now need to dig in further into my PM system, EMR, and tackle my IT guys to start to answer the questions. So what we really want is this ability to look at data in a combined fashion and give this data to our executive team, even our mid-managers, who can be able to use this data to collaborate and make patient flow, patient experience, patient outcomes, efficiency, and the financial pieces of my practice work well. But the reality is that data tends to live a bit on an island in only the hands of a few. So we took this data quandary and we took the 3 pillars of a data strategy and we used this to help guide our data analytics strategy via ModMed. So we're going to take a moment, we're going to talk about what's here, and then we're going to talk about what's next. So when we talk about the first challenge of data, we all are talking about compliance. Every one of us are looking at things like the upcoming MIPS. Several clients have just received the QRGs from the 2015 reporting time and are experiencing either positive or negative impacts related to it. So what we've all learned is that compliance is graded on a curve, and compliance will have winners and will have losers that will impact your bottom line. So within EMA, you know we have a MIPS reporting section. This allows you to see how your doctors are doing component by component. But we just introduced as well is the ability from within EMA to look at analytics on your MIPS performance. Many folks don't know it, but you can activate this at no charge. If you go into the firm admin and go to Manage Analytics Settings, you can look to click off the included 1 per practice option. This gives you a at no cost seat at the table to some of our premier analytics pictures. One of those analytics pictures is our MIPS comparison. And what this allows you to do, and I'll show you the app here in just a minute, is look doctor by doctor by doctor at all of the different MIPS pieces, so all of the different blocks, and understand your physician's score, but also the recalculated MIPS comparison for 2017. So if you were to look at this example up at the top, and this is the quality score by each doctor, you could clearly see that you have 3 doctors that are well overperforming, and you have 2 that are, doing okay, and 1 that's not doing so well, because I can see that the calculation for the MIPS comparison is really highlighting this doctor's underperformance. So the most aggressive way to keep yourself on the positive side of the curve is to monitor your MIPS quality scores and all of your MIPS component scores and try to angle them up to the higher end of the curve while exceeding your peers. So this particular offering shows me where is my entire practice, all of my doctors. Where am I? So as Dr. Jones, where am I compared to those doctors? And then where am I, Dr. Jones, compared to my peers? Right? MIPS is also a comparison that is not specialty specific. So the MIPS comparison is comparing our entire market share across the modernizing medicine world. From the MIPS comparison option, you can also complete some improvement activities looking at population health, as well as regular reviews of targeted population activities. And I'm going to go ahead and take you to that app now. Please understand that I'm demoing out of a test database. And so this is just to give you a feel for the look and touch points of the app. When you open the app, you'll get to the MIPS Getting Started page. This is going to allow you to toggle between the big pieces of the MIPS picture: quality, advancing care, and those improvement activities that we talked through. Each of these represents the box that is also found within EMA. So we're looking at the quality score. I can see all of my physicians listed down here at the bottom. And if I'd like to go ahead and highlight just a few of them because I want to look at them in more detail, I can do just that. In our live environment, you'll see the live MIPS compare. You're also able to drill down measure by measure to look at each of your doctor's performance rates. As always in our analytic platform, right-clicking exports the data. So you can export this to a data table, or you can export this to a picture or a PDF as well. As we move through this app, we can see that we can look at the quality scores in detail, advancing care scores, improvement activities. We can look at the overall MIPS comparison scores, so the actual end product box. But also notice that you can actually complete some improvement activities from this app as well. If we were to go through engagement of community for health status improvement, this is going to remind you that you can actually meet this by utilizing our specialized registries, which we'll talk about here in a second. You can use this app as well to do population health research. This app allows you to combine things in your database like year. So I want to look at patients who were seen last year for a specific EMA diagnosis. Maybe I want acne. This allows me to get a targeted zip code picture, but also a complete patient list, which is exportable as well. To meet this criteria for this activity, we would download this details table, print it out, and put it in a file. You've now done population health research based on a particular diagnosis. We take this one step further in the next activity. This allows you from a dermatology aspect to look at, say, the diagnosis of melanoma and create a patient list and even add things like a specific year or a specific month, and then go ahead and download that list of patient melanomas. We have one more that's just in progress at the moment, which is the ability to look at your telehealth services to expand patient access. This one is right now just in progress and should be released here just the next few weeks, but it allows you to look at your telehealth volume over time, along with detailing a detailed patient list. So that's the compliance piece. And we feel as if you were to provide the compliance piece more visibility within your practice. This can help improve your scores just by visibility. So let's talk specialized registry. This too is included in your EMA subscription at no extra cost. You can register for the specialized registries and look at your specialized registry patients list right from EMA. But through the Analytics tab, you're able to actually view your data and comparison for each disease state. My apologies. So what I'm looking at is the dashboard that allows you to see your practice's data, along with your practice's top 10 prescriptions and your practice's brand and generic use. You can then compare your profile with the profile within the registry. So for example, I'm looking at the pruritus registry here. I can see that in my practice, we wrote 437 prescriptions. You can look at the distribution of the top 10 prescriptions and the brand and generic use from here as well. Access to those reports are all controlled via Firm Admin. They are available 1 seat per practice at no cost, but also available through our clinical premium analytics. So let's talk about that just a little bit, because the offering of a premium analytics bundle is really what allows you to execute on a strong data strategy, particularly across our products. So we're going to look at a brief tour. You should know that this is available for general release in dermatology, and other verticals are coming soon. So I'm not going to go through all the bells and whistles of the premium package, but we will start on this Getting Started page, which gives you a nice overview of the breadth, where you can look at things like practice census and RVU census. This allows you to track the number of patients by volume or number of patients by RVUs. Those of you with our practice management system also might see that this is very clearly similar to our executive financial dashboard layouts as well. We're going to start, though, with our most popular report, which is our Advanced Clinical Targeting report. This report is made to solve a lot of needs. First, it's made to be able to identify cohorts of patients, but it's also made to identify cohorts of patients that did or did not do stuff. Right? You can think about this in a lot of ways, and we want to look for patients who may have fallen through the cracks that were supposed to be in for something that never came in, maybe something like a melanoma screening. Or I want to look at patients who came in for one Botox but never came back for any more. Or patients that I order bone density studies on a regular basis but haven't been back for several years. So what this allows you to do is pull a detailed patient list that's based off a set of different parameters. In this test database, let's go ahead and use melanoma. So by clicking the melanoma button, I have now identified in this small test database 88 patients who either have the ICD-10 or ICD-9 associated with melanoma. This patient list is already here, right? And immediately, if desired, I could download this. The nice part about this download is it's a very clean Excel worksheet without a bunch of jumbled fields, no merged fields. You can then manipulate this very cleanly from here. Right? So that's one thing. Now, what if I wanted to add some more information? So I have my melanoma patients listed here. Maybe I want to see who came in 2015 and 16. Right? So notice I've taken that list of 88 patients, and now I'm down to 73. All right? And that's great. Maybe that's the wall I was looking for. But maybe I want to see who did not come in for something this year. So who did not come in 2017? So now I've generated a list of patients who were seen for melanoma in 2015-16 who have not yet been in for 2017. So you can now see I've generated a patient list of 70. So when you start to look at this, the combinations are fairly endless, and we're adding more features every day. I can add things like EMA plan or medications. And if you click on the extra button, you can see all the different pieces. I want to look for specific biopsy results. I want to look for specific referring providers, specific EMA diagnoses. So this ability to combine any data point listed here and more are added every day, and be able to create exclusion lists to nail down patients who you either want to market new services to, or you want to figure out where they went. This is the core of one of our advanced analytics offerings. The next most popular piece that we see is our patient demographics information. Now again, I'm on a limited data set, but you can see I can look at my patient demographics across the age groups. I can begin to drill down. Maybe I just want to look at patients age 51 through 80. Maybe I'd like to add something like a specific EMA diagnosis and I can just select one or multiple things. Notice I can create a patient distribution by zip code, and in a large database, it's even more impressive. But if I click on this, I can use the lasso tool, and I can even get down, and in this one, it's just showing me Boston General. But if I scroll in, I can actually get into the map details, just like you would on, say, a Google Maps. I can see gender, ethnicity, race, and even their primary listed insurance. In any of our dashboards, the ability to launch a data table is also there. You can see we have referring provider information, so the ability to see who's sending you patients, ability to look at things like how long it's taking to finalize notes, and even just the ability to create a billing summary or a coding summary. This is very helpful in our clients that have third-party PM systems. They want to see exactly what is coming out on the EMA Superbill and be able to launch a data table that they can then download and even provide access to their billing staff. We're working on several pieces related to inbound and outbound faxing, allowing you to see who's faxing you things and who's linking those faxes, as well as from the outbound, who are you faxing to and what type of faxes are you sending by what type of specialty, recipient distribution, and even fax template. So faxing is definitely one of our next big pieces as well. But what you'll see with the premium analytics is a recurring core. What we're trying to do is help you solve for the 3 pillars of a data strategy. We're trying to provide you, where possible, complete data sets that connect billing information such as ICD-10, CPT codes, modifiers, with clinical information. And that doesn't yet require ModMed PM. But as our ModMed PM database begins to grow and grow, we'll start to connect things like reimbursement rates and connect things like allowables and insurance distributions to clinical data to help you better understand your payer distribution's impact on your clinical practice of medicine. We also see this as a tool that's very easy to use. So you can avoid the data island by starting with the same data sets across the board of your organization and drilling from the orchard level view all the way down into the trees, down into the branch, and then down into the apples. This allows you to look at things in more detail from a population health aspect, answering the hard questions of building cohorts of patients, such as who did what, who didn't do things, who didn't follow through on particular metrics. Looking at things like care access, where do my patients live? How far are they traveling? Where are my referrals based from? Is there somewhere where I should be thinking about a satellite office? The ability to identify revenue gaps. Who got the workup but didn't execute? Who's late on their recurring preventative services? Who should I be marketing for cash generating service lines? So we've worked through compliance and we've worked through patient population management, but we also have the ability to do audit risk. Am I billing specific coding levels at a different rate than the current CMS data or the current EMA comparisons? This allows you to look physician by physician for outliers or for ones that might need more education on the ability of EMA to get to the right codes. Lastly, we step into the next frontier. So as we're taking this look at the orchards in the very large view of the landscape in front of us, as a practice, we have to understand, do we have enough land? Do we get enough sun? Are we growing the right fruit? Do we have the right groundskeepers? And do we have any bad apples? So this scenario brings us right back to where we think the future is coming from. The future of being able to combine data sets, but specifically combine things that haven't been combined yet. So let's take an example. If we want to look at clinical outcome A, you could plug this into any medical outcome. We want to be able to provide you with the ability to look at the variables that could affect measure or clinical outcome A, which insurance company wants to judge you on. We want to be able to give you the ability to look at clinical outcome A by practice variables. Does this look different by location? Does it look different by provider? Does it look different if the patient's wait time was a week, 2 weeks, a month, 6 months before they were able to be seen? Does it vary by the time that the patient spent in the waiting room or time they spent with staff? Does it vary depending on the staff they spent time with? Does it vary by provider? Well, we want you to be able to cross-reference those outcomes by patient variables. Does it look different by age, by comorbidity, by geographic location? Do certain patients who are referred by specific referring providers have different outcomes profiles? I wonder if I could correlate this with satisfaction metrics. Good food for thought down the road. What do the outcomes look like when they're correlated with different medications? So we want to empower you to become almost your own question and answers. Be able to ask questions about the hard outcomes and be able to find the correlations which might be driving your specific trends. This is coming soon. How do you get to the app? Julie. Okay, I'm going to share my screen and go into just one of our test databases here. Okay. I'm in one of our, this is the one for practice management, but the look and feel is very much the same. If I go, I'm in firm admin, I'm in practice settings. All right. You should see, and if you don't, please let us know, a Manage Analytics button. Now, one seat is available to for some limited reports to the practice to included in their EMA license. And you'll see that by seeing this included one per practice, right? From here, you can choose a non-physician, sorry docs, it's just admins. You can choose one person to receive or have access to those specialized registry and or MIPS reports. Now, if you're a premium subscriber already, these are included already in your access. So you would just manage your people over here. And of course, those of us on ModMed PM can see those here. All right. Now, keep in mind, there's this little disclosure here. The settings take 24 hours to take effect. All right. Now, as I log in to see these, I'm going to log in, and with the appropriate privileges, I'm going to see this analytics button. This is going to bring me to all the different analytics that I have options for. Since I'm in a practice management environment, I can see all the PM analytics. If I go to clinical and operational, here is clinical and operational landing page, and here is the MIPS report, as well as the specialized registry. By clicking on any of these, it's going to open a separate tab and lead you to the landing page of that application. Okay. Again, takes 24 hours. All right. Let's go through the rest of the questions. Where do I download the app? I just covered that. Will this webinar be online? Absolutely. Does Emma provide one analytics license at no cost? Absolutely, it does, but it is limited to specialized registry and MIPS. All right. The analytics tool is already in general release for dermatology, so all those advanced dermatology reports are already available. This is in general release for dermatology. It is in beta release for several of the other verticals. Can you only get to the Manage Analytics from the firm admin logon? Yes. Since this is a firm administrated access point, you can only grant access to Manage Analytics from firm admin. Is this currently available? And do I need to wait for release? It's available for derm. Betas for other verticals. How much is it to get premium analytics? As always, you got to talk to your sales rep because it's a combination of different factors. I've activated the one user in May and I still can't see the clinical side. Lene, hey, open a support ticket for us so we can take a look. Let's see what's going on your neck of the woods. What type of practice account role and privilege has to be registered? It can be anyone except a physician. It can't be a physician. And then thank you. Excellent. It looks like we got to all the questions. Now, just as our closing remarks, a couple of take-home points. All your MIPS questions, remember we have the MIPS Promise, MIPS Coaching, but we're also here to help you navigate the MIPS dashboards within Emma and within the analytics platform. Second piece, if you're interested in the premium analytics, which includes things like the patient clinical targeting report, please just reach out to your sales or account management representative and they'll talk you through any of the details as well. As far as when this webinar will be online, I believe within this next 2 weeks, but we'll go ahead and we'll include more information about how to access the webinar online in the post-webinar follow-up information that you will receive. You guys put me through the ringer. So I want to take a moment to thank everyone for joining. Please submit the post-webinar survey for more information, and have a great afternoon.